Hi, I'm Julianne. I'll be your student nurse today. Are you in any pain today?
No.
And do you have any allergies that I should know about? Okay, so I'm just going to wash my hands. Okay, I'm going to provide privacy. And can I have your name and your birth date?
Rachel Snarski, 12/10/94.
Okay, so the patient looks her stated appearance. Not seeing any obvious signs of illness. Can you tell me what the date is today?
April 5th.
Okay, and about what time is it?
9:30.
Okay, and can you tell me where we are?
University of Detroit Mercy.
Okay, so the patient is oriented ×3 to person, place, and time. Her mood is cooperative and compliant. Her mood is appropriate. Overall, her hygiene looks very good. Looks like she practices grooming. Okay, looking at the skin on her face and her neck, it's a nice even color, no erythema, cyanosis. I'm just going to feel. Temperature feels warm, no diaphoresis. Looking at her hair, it's a nice even brown color. Looks evenly distributed, not seeing any lice or anything else in her hair, so I'm just going to feel. Okay, the texture feels good. No bumps or lesions underneath the hair, so that's a good sign. Take a look at your eyes. Okay, just look straight forward. Okay, and then I'll have you follow my pen light. Okay, and then follow it right in. Okay, so the color of her eyes is a nice brown on both sides. They're symmetrical. The conjunctiva is moist and pink, and the sclera is white. Doesn't have any lesions on it. The pupils are equal, round, and reactive to light, and they accommodate. Okay, so I'll have you open your mouth. Okay, the oral mucosa is moist and pink. The gums, I'm not seeing any bleeding. Those are also moist and pink, so that's a good sign. Her teeth are nice white color. Have you opened? Not seeing any permanent appliances or dentures. All of her teeth are present. I'll have you stick your tongue out. Okay, no lesions on the tongue. And then stick it out a little further. Okay, the uvula is symmetrical, and say ah for me. Okay, and it rises midline. Her tonsils are, I'm not seeing any enlargement or drainage, so I give those a grade 1. Those look good. Okay, so then I'm just going to feel on your neck. Feeling the carotid side. Okay, her carotid arteries have equal rate and rhythm. I'll grade those 2+ bilaterally. I'm going to listen with the bell. Okay, no signs of bruise or abnormalities there. Her face overall is symmetrical. So I'm going to test some cranial nerves, so have you smile for me. Okay? No drooping on either side of the face. Have you puff your cheeks. Okay? Cranial nerves 5 and 7 look good. Looks like they're intact. I'll have you close your eyes. And then just tell me where I'm touching on your face.
Forehead. Chin. Left side.
Okay, and that's also cranial nerve 5, so that looks good. Okay, so I'm just going to look at your upper extremities now. The color overall looks very good. Temperature is nice and warm, no diaphoresis, not seeing any lesions or anything like that, even hair distribution. Okay, I'm going to feel your radial pulses here. Okay, good rhythm. 2+ bilaterally, and come up and feel your brachial pulses. Okay, equal rate and rhythm, 2+ bilaterally. Now use your fingernails. Capillary refill is less than 2 seconds, so that's a good sign. Have you press up on my hands. Go ahead, press down, and then squeeze my fingers. Okay. The muscle strength in the upper extremities also feels good. Okay, so for the landmarks of the heart, have you sit up straight? Okay, so on the right side, on the second intercostal space, we have the aortic region. Second intercostal space, left sternal border, we have the pulmonic. Third intercostal space, left sternal border, we have Erb's point. Fourth intercostal space, on the left sternal border, we have the tricuspid. And in the fifth intercostal space, mid-clavicular, we have the mitral area. I'll listen with my diaphragm first. Okay. Okay, thank you. Okay, and then at the mitral area is where I listen for the apical pulse for 1 minute. And then I'll listen with the bell. Okay. Okay, so I heard S1 and S2 sounds. I didn't hear any extra S3 or S4, no murmurs, bruits, anything like that. The S1 was heard louder at the apex, whereas the S2 was heard louder at the base. Okay, so I'm going to listen to your lungs. Have you sit up straight, and then just take deep breaths for me. Okay, and then I'll do the posterior. Okay, so the lung sounds were clear and equal. Bilaterally, didn't hear any wheezing, crackles, rhonchi, anything abnormal like that. So I'll just have you lean forward a little bit for me. Okay, feeling the spine. Feels straight. Didn't see any indications of scoliosis or anything like that. So her ratio is a 1-to-2 ratio, so I'm not seeing any signs of barrel chest there. And then tell me if you feel any pain or tenderness when I do this. Good. All right. So the costovertebral angle, no tenderness or pain there. Okay, so then I'm going to have you lay down. And I'll lift your shirt so I can inspect your abdomen. Okay. So just inspecting, the contour of the abdomen is flat. It's an even color, it's symmetrical, not seeing any visible distension. So I'm just going to listen now. Okay, the bowel sounds are normal, active in all quadrants. And then I want you to tell me if you feel any tenderness or pain when I do this, okay? Any pain or anything? Okay. Didn't feel any abnormalities, any lumps or fluid buildup or anything, and no tenderness. For the organs, in the upper right quadrant, I would find the liver and the gallbladder. In the upper left, I would find the spleen and the pancreas. In the lower left, I would find the sigmoid and descending colons. And then in the lower right, I'd find the appendix and the ileum. Okay, so you can put your shirt down. Have you sit up. I'll have you look this way. Okay, and I'll have you look this way. I'm not seeing any jugular vein distension, so that's a good sign there. Now let's have you, lift your pant legs up as far as you can.
Jesus. Be fast, because I might lose circulation.
Okay. So looking at the color of her legs, you have to take your shoes off. They're an even color. I'm not seeing any lesions on those as well. Check for, see if there's any edema. That looks good. Okay, I'm gonna feel for some pulses. That one. Okay, so the dorsalis pedis pulses are equal bilaterally, and they have a 2+ rate and rhythm. Feel the posterior tibial pulses. These have equal rate and rhythm, 2+ bilaterally, and they'll have you press up against my hands, and then go ahead and pull back. Okay, so the muscle strength in the legs feels good. You can put your pant legs down. Yeah, you have to do that.
Just leave it.
Okay, so I'm gonna have you stand up and put your feet together, and then I'll have you try to maintain your balance when you close your eyes. Okay, so the patient maintained good balance. Also, the Romberg test is negative. So what I'll have you do is sit back down, and then I'll have you get up, walk right over there to the counter and come back. Okay, so the get up and go test, the patient was able to stand up on her own and walk appropriately, and her gait was smooth and rhythmic.